Approved use. Aimovig, erenumab-aooe, is a prescription medicine used for the preventive treatment of migraine in adults. Important safety information. Do not use Aimovig if you are allergic to erenumab-aooe or any ingredients in Aimovig. Please see additional important safety information later on in this video.
I'm a very diligent studier. I focus very strongly on what I'm looking at, and I kind of just get in the zone, so much so that if someone's sitting next to me and going, Delora, 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 hey, hello, and then I'm like, oh, what's going on? Because I'm thinking about the brain or hormones or whatever it is that I'm studying. I'm not thinking about anything else. And so I kind of have to be brought out of my study zone, back into the real world. I think my favorite thing about college is that it's a chance to kind of make yourself into what you want to be. I think the most valuable skill that I've learned from my time here in college is balance. College did definitely change for me after being on Aimovig and having fewer monthly migraine days. I cried tears of joy when I realized I wasn't going to have a migraine day every day. I began to remember how much I've always loved to put on makeup and to fix my hair and to dress up and just to look good. I started taking courses that I was really interested in. That fall is when I took my very first neuroscience course. I'm absolutely fascinated by the brain. And it's also very uniquely interesting to me because I have migraine. When I walk in the lab, it's like, okay, now I'm becoming the scientist, I'm becoming the researcher. I feel very fortunate that I'm able to work in research in an area that I'm so passionate about. Having a dating relationship while I was dealing with migraine was just very difficult. Like, you have to be able to handle your own life before you can start to think about intertwining it with someone else's. I kind of just met Patrick at the perfect time, kind of introduced the concept of what I want the rest of my life to be like, to have someone special to kind of do life with. Having fewer monthly migraine days is what it took to get me to a point where I could take care of myself better. I recognize how blessed I am. I'm fortunate enough to attend this university. I'm fortunate enough to have a job, to have friends, to have a boyfriend. I'm fortunate to be able to study neuroscience. I'm incredibly grateful that I've been accepted to medical school. Eventually, it will pay off, but I don't want to rush.
Important safety information. Who should not use Aimovig? Do not use Aimovig if you are allergic to erenumab-aooe or any ingredients in Aimovig. Before starting Aimovig, tell your healthcare provider, HCP, about all your medical conditions, including if you are pregnant or plan to become pregnant, breastfeeding, or plan to breastfeed. Tell your HCP about all the medicines you take, including any prescription and over-the-counter medicines, vitamins, or herbal supplements. What are possible side effects of Aimovig? Aimovig may cause serious side effects, including allergic reactions. Allergic reactions, including rash or swelling, can happen after receiving Aimovig. This can happen within hours to days after using Aimovig. Call your HCP or get emergency medical help right away if you have any of the following symptoms of an allergic reaction: swelling of the face, mouth, tongue, or throat, or trouble breathing. Constipation with serious complications. Severe constipation can happen after receiving Aimovig. In some cases, people have been hospitalized or needed surgery. Contact your HCP if you have severe constipation or constipation associated with symptoms such as severe or constant belly pain, vomiting, swelling of belly, or bloating. High blood pressure. High blood pressure or worsening of high blood pressure can happen after receiving Aimovig. Contact your healthcare provider if you have an increase in blood pressure. The most common side effects of Aimovig are pain, redness, or swelling at the injection site, and constipation. These are not all of the possible side effects of Aimovig. Call your HCP for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.
Oh, my friends had to convince me to leave my hair curly. I asked every single one of them. I was like, okay, I should straighten my hair. They said, it's who you are, Delora. You're Delora with the curly blonde hair. And I was like, okay, fine.